Hello, I'm here to talk to you about disinformation and rebuilding trust in science. I'm Ezekiel Emanuel. I'm the Vice Provost for Global Initiatives and the Co-Director of the Healthcare Transformation Institute and a professor at the University of Pennsylvania. Trust in health institutions is facing a historic crisis. Declining trust in science is not just a U.S. phenomena, it's worldwide. From 2021 to 2023, satisfaction with health institutions fell in 16 out of 19 OECD countries. That, according to Edelman Trust Survey from 2024, which is Edelman is a PR firm in the United States. Majorities view research scientists as very intelligent, but only 45% view them as good communicators, and that undermines trust. We have a conundrum about COVID-19. There was an unprecedented success in the COVID-19 response. Unlike the 1918 influenza outbreak, where between 50 and 100 million people died worldwide, and the 2014 Ebola outbreaks in Africa, which saw high mortality rates and slow response times, the global COVID-19 response was both fast and precise and saved many lives. International genomic and wastewater surveillance happened very quickly. Within a few weeks, we had the genomic sequence of the SARS-CoV-2 virus. There was a rapid regulatory intervention so that we could limit the spread of the infection. Within a year, there was the development of safe, effective vaccines for COVID, and at least 2.5 million lives are estimated to have been saved, and as many as 15 million life years were saved. And yet, trust has declined. Here is a graph looking at this trust conundrum. The triangles are May 2020, just a few months after COVID started, and the black line is March 2021, 3 months after the vaccine began to be distributed and used in the world. And you can see in every country here across Europe a decline in trust. Here is Germany, for example, a decline of 1.5 points in trust. But it's not the only place that saw a decline. Here's Austria. Here's Cyprus. So you see a decline worldwide despite a very effective COVID-19 response. The politicization leading to distrust and influencing distrust has had real tangible effects. It's actually increased the number of people who have died. Studies show that post-COVID excess mortality in the United States differed by political affiliation due to the variations in how people perceive the vaccine and how people took up the vaccine. Here, the blue or gray graph is Democrats who generally supported the vaccine and took the vaccine. And the orange are Republicans who objected to the vaccine and view it with suspicion and were very hostile to the mandating of a vaccine. And you can see here, after open vaccine eligibility, so everyone could get it, Republicans had much higher, more excess deaths compared to Democrats who had much lower excess deaths. So one consequence of this politicization and the decrease in trust of around vaccines is that people are dying from lack of coordinated, authentic health communication and trust in those health information. One of the big ways that this gets communicated is through content curation algorithms on social media. It turns out that 65% of female TikTok users actively sought out health information. It's one of the most actively sought out aspects of TikTok. And then 92% were passively exposed to health content. That means that almost everyone, no matter what they're looking for on these social media platforms, get health information sent to them so that they're often exposed to whatever their search engine leads them to. 40% of respondents report trusting influencers as credible sources of information, even though almost all of these influencers have no credentials and no expertise. And it turns out that 20% of people actually rely on LLM chatbots to serve as their primary source of health information. When they have symptoms or problems, they search with chatbots rather than relying on experts. This shows you that once they stay get in a bubble, they stay in that bubble because the algorithms keep giving them information that they want. This shift from relying on experts, medical experts and public health experts for information to relying on lay people and influencers for authentic and authoritative information is actually driven by 5 factors. One is what might be called the invisibility paradox. When science and biomedicine succeed, they're often invisible because the major problem is averted. So in COVID, deaths were down. Hospital closures didn't have to happen because they weren't overwhelmed. It makes it hard for people to see the impact of the interventions, whether masking or vaccines. And so the public health success actually becomes invisible. A second effect are parasocial bonds. By looking at social media, people form one-sided relationships with influencers and others on social media, trusting them because of their intimacy. They therefore trust intimacy over expertise and accuracy. And influencers build this intimacy and build this trust by repeated exposures with them. These parasocial bonds make people feel like the influencer is actually a family or friend, like they know them in a very deep way. Emotional resonance is slightly different from parasocial bonds in that it can happen with one exposure. You can rely on someone like me. That influencer looks like me, acts like me. They often broadcast their TikTok from the kitchen or doing their makeup or in some way that is so informal that people feel like they're just like me. This means that authenticity trumps expertise and authority. People gravitate toward communicators who feel sincere and unfiltered, and they trust that unfiltered aspect. The fourth way in which we've had the shift from expertise to lay people is well known. It's called cognitive biases. As people, we tend to seek and interpret information that aligns with our values and views. We actually want information that confirms what we already believe. And a lot of influencers frame the information they have that aligns rather than challenges what someone's worldview is. This way, we go back to people, influencers, who actually reinforce what we believe rather than seeking out people who might be skeptical of what our beliefs are. And the last effect that shifts from experts to lay people is cognitive simplicity. One of the things public health and medical experts tend to do is to emphasize the nuance, the subtlety, the differences of different groups, and that creates lots of complexity. Whereas lay people and influencers offer quick, simple answers, frequently just checklists for people to adhere to. We have to remember that people who are looking at videos often have busy lives. They have busy lives trying to keep their house together. They have busy lives at work. They might have children that make demands on them. They don't have the time to pursue the subtlety and the very, very important differences that we scientists think should be emphasized. They want, what do I do? Give me a checklist. And we are very bad at communicating that. And so they go to influencers instead. So to rebuild trust, the challenge is to balance scientific nuance with the demands for authenticity and intimacy. Now, scientific nuance is what needs communicating. It's the substance. Authenticity, intimacy, informality, that's how to communicate. The what and the how don't have to be in conflict. They have to come together if we're going to be effective in rebuilding trust. This leads me to 5 recommendations. First, public health experts and medical experts have to prioritize authenticity and emotional intimacy along with communicating their scientific accuracy and expertise. That means they have to dress informally, they have to appear in informal settings, and not be formal in the way they do it, not wear the white coat and stethoscope. So we have to prioritize the way in which we can obtain emotional intimacy while communicating about scientific accuracy. The second recommendation is to demonstrate independence and integrity. We have to emphasize public health officials and medical experts have to emphasize that we're independent, that we're not beholden to either political groups or corporations and through financial ties, and that our views are meant to be for public health achieving, not for us getting money or other issues. One of the things that is true of many influencers is they have financial conflicts of interest, and we need to differentiate public health experts and medical advice based upon not having financial conflicts of interest. Third recommendation, redesign communication for digital and social media, not for traditional media. Traditional media, an expert appeared on TV and communicated down to lay people. This is vertical, the experts on high communicating down. Social and digital media is more horizontal. Communication is peer-to-peer. So I appear as a peer with the person who is looking at the social media video. It's very important to redesign how we communicate so we appear more like a peer that has some new information. Fourth, we do have to engage in how algorithms are governed, how AI is used in modern social media. The AI curation of information gives people things that reinforce their worldview and doesn't challenge it. That is leading to very bad results if people only hear their skepticism or their hostility or their distrust of science and public health and medicine. We need to change those algorithms so that they don't keep people in an information bubble, but they expose them to views that aren't ones that reinforce their view, so we can undercut the cognitive biases they have. And last, we can't wait for the next COVID-like crisis or the next pandemic to begin this effort in rebuilding trust. We have to immediately invest in long-term trust rebuilding because that takes a long time. If we wait to a crisis, we're going to lose people right away. So, in rebuilding trust, the challenge is to balance scientific nuance and information with the demand for authenticity, intimacy, and simplicity in delivery. This is something we can do, but we have to understand how to communicate to the public. The way we've done it traditionally is not going to work any longer. I hope this is helpful in you're learning how you can change your communication style to be more effective in an era of digital and social media. Thank you.